Hey guys, Brian back at Strong Tower Training, Z-Health trainer and functional aging specialist. I'm excited to bring you a video today for anybody, especially that's been sitting a lot. So have you been sitting a lot? Have you been sitting more than usual? Are your hips tight? Have you been experiencing any sort of bowel or bladder issues that can come about because of tight hips? Have you been having any low back issues? Again, sometimes that's tied to tension in the hips. I was just working with somebody and they've been having back pain and bending over. So like when they hinge or bend over, they've been doing a lot of gardening lately and she loves to garden. And we did this drill and significantly knocked down back pain in under 5 minutes. So it's tightening or a shortening of the psoas muscle. Psoas is a really important muscle that goes anterior to posterior in the hip and low back, the pelvis and low back. And we're going to first contract or tense it, and then we're going to lengthen it back out and stretch it. So we're going to do one round together today. So I'm just going to show you one revolution through this. So if this is a good drill for you though, it's a good exercise, I would encourage you to do maybe 2 or 3 rounds through it on each side. So instead of doing one on the right side, one on the left side like we're going to do today, you could go back through it on your own 2 or 3 times where you shorten and contract the muscle for about 10-15 seconds and then you release and lengthen it back out. So I'm going to be close to a wall. You can be close to a wall, countertop, stable object that you can hold on to. I'm going to hold on here and then go ahead and start on my left side. I'm going to bring the leg up into hip flexion, then I'm externally rotating. So I'm going to bring the knee out away from my belly button and bring the foot up and in towards my belly button. From there I'm going to rotate away from that side. So I'm rotating away from that leg and I'm going to side bend. So I'll give you a different angle here. I'm going to side bend in like I'm trying to bring my left shoulder to my left knee. I want to squeeze in the lower abdomen. So all these muscle joint actions are combining to shorten that psoas muscle, tighten it, hold for about 10 seconds. And then on that same side, we're going to step that foot back into a reverse lunge. We're going to turn in at the hip. So instead of externally rotating with the knee out, we're going to kind of swivel the knee in. I'm going to then rotate in towards that side, reach up and back with that same side arm. So I'm lengthening now through that psoas. Feel a nice stretch through here, right where I was having that nice strong muscle contraction before. So lengthen it out, hold for about 10 or 15 seconds. Again, in the example that I just gave with the person that I was working with, we did 2 rounds through that, and she got some significant relief. So you could go through a second time. I'm just going to show you on the other side. So we're going to go ahead and bring the knee up, externally rotate at the hip. I'm rotating away from that side, so I'm rotating my trunk away from that hip, and I'm going to drop my same side shoulder in towards that hip or knee. And you can see balance is challenged a little bit here, so that's why, again, I encourage you to be by a stable object. Hold on if you need to. We want to squeeze that lower abdomen, squeeze, squeeze, squeeze. Get a nice strong contraction. Hold for 5 to 10 seconds, and we're going to release back out of it. So I'm stepping back, I'm turning my foot in, internally rotating at the hip. Now I'm going to rotate the trunk towards that side or towards that hip, reach the arm up and back, and then lengthen up and back, feeling that nice deep stretch in the front of that hip, lower abdomen area. So hold in the stretch for about 10 seconds. Guys, go through that a couple times. If you have any questions on this drill, let us know. Drop a comment. If it helped you, please drop a comment and let us know that too. And thanks for checking out the video.